Hi, I'd like to welcome you to this webinar on depression, mania, and suicide. My name is Mike Lau, and I am a clinician at Health Directions. I'd like to begin by talking about some of the general characteristics of a mood disorder. Mood disorders encompass both depression and mania. And the characteristics of a mood disorder involve disabling disturbances in an individual's emotions. First of all, depression. Characteristics of depression, symptoms of depression include things like sadness, worthlessness, guilt, withdrawal from others. We'll typically see individuals express feelings of helplessness, hopelessness, feelings of worthlessness, also a change in their sleeping pattern. This can be an increase or a decrease in their sleeping pattern. We'll see a change in a person's eating patterns, typically an increase or a decrease in their eating. A decrease in interest in their pleasurable activities. Things that brought interest, such as hobbies in the past, will find typically a decrease in those activities. Sports, things that brought them pleasure in the past, again, a decrease in those activities. Mania. Symptoms of mania include intense but unfounded elation. Typically, we'll find that individuals who are suffering from symptoms of mania are very irritable, hyperactive, very talkative. They will express a flight of ideas, not only within their words, from word to word, but sentence to sentence, paragraph to paragraph. Extremely difficult to follow their ideas. They're very distractible, goes along with their talkativeness, their hyperactivity. Very unrealistic plans, very unrealistic style of thinking about things, about the future. These symptoms, the intense but unfounded elation, irritability, flight of ideas, talkativeness, hyperactivity, distractibility, these things can last either from several days to several months. Also, along with the talkativeness, flight of ideas, their general speech is extremely difficult to understand. We often describe this as kind of word salad, a bunch of words just kind of thrown together at times. The formal diagnosis of major depression. So, for example, for somebody who would be clinically diagnosed with major depression, this would require 5 of the following symptoms for at least 2 weeks. They would need to exhibit a depressed mood for more days than not out of those 2 weeks. They would need to exhibit or describe a loss of interest in their pleasurable activities, again, such as hobbies, things that brought them interest in the past that don't bring that same interest. They would need to describe significant changes in their sleeping pattern. Again, this would be either an increase or a decrease in their sleeping. Significant changes in their activity level. They'll often describe a decrease in their motivation, so it's sometimes very difficult for them simply to get out of bed in the morning. Significant changes in their eating patterns, either an increase or a decrease in their eating. Loss of energy, fatigue, feelings of worthlessness, feelings of hopelessness, feelings of helplessness are often common with major depression. A negative self-concept is often a common symptom of major depression. Individuals who are suffering from major depression will often describe difficulty concentrating and recurrent thoughts of suicide. Thing about suicide is that, again, this is something that does not necessarily need to be present to actually make up that clinical diagnosis of major depression. Again, we look at 5 of the following symptoms that need to be present for at least 2 weeks. So the presence or the non-presence of the current recurrent thoughts of suicide. Some general statistics on depression. Lifetime prevalence rates range from about 5% to 17% in the general population. Depression is 2 to 3 times more common in females than it is in males. Typically, it will occur more frequently in those who are lower in socioeconomic status. So those who have lower educational status, those who are living in areas that are suffering from poverty. Depression will occur more frequently in young adults. We'll typically see the diagnosis of major depression occur in individuals who are in their late teens to young 20s. It tends to be a recurrent disorder. So typically, if somebody who is suffering from a diagnosis of major depression has this diagnosis, unfortunately, the statistics show that that diagnosis will reoccur sometime later in their life. The formal diagnosis of bipolar disorder. Again, this involves episodes of mania or mixed episodes that include both mania and depression. This will require the presence of elevated or irritable mood plus 3 additional symptoms. When we look at bipolar disorder, we're also looking at the symptoms impairing the person's social or occupational functioning, the way they're functioning at home, how they're functioning at school, how they're functioning at work. The symptoms of of somebody suffering from bipolar disorder include increased activity levels, extremely rapid speech, to the point where it's very, very difficult to understand what they're saying. It's very difficult to follow what they're saying. Again, flight of ideas. They go from topic to topic, from concept to concept. Typically, there's no connection between what they're talking about. We'll usually find that there's less than the usual amount of sleep. People who are suffering from a bipolar disorder will go 3 to 4 days without sleep. You'll then ask them, do you feel tired? They'll say no, and they'll go for another 2 to 3 days without sleep. Inflated self-esteem. Very distractible. Again, going from topic to topic is pretty easy for them. Excessive involvement in pleasurable activities that are likely to have undesirable consequences. So running up your credit card bill, for example. And that's not simply running up a credit card bill for $100 or $200, but $20,000, $30,000, $40,000. So excessive involvement in a pleasurable activity, it's going to have an undesirable consequence in the end. With the undesirable consequence, the person's not going to have any insight to that. They're not going to understand what consequences those activities are going to bring about. Some general statistics for bipolar disorder. The lifetime prevalence is about 1%, so it's a little bit less than the 5 to 17% we saw with major depression. Not as common a diagnosis. Average age of onset is, again, in the early 20s, very similar to major depression. We'll typically see this in late teenage years, early 20s. It typically occurs in equally amongst males as it does with females. Similar to major depression, recurrence of bipolar disorder is likely. Moving on to chronic mood disorders. The chronic mood disorders are similar in symptomatology to major depression and bipolar disorder. Biggest difference is they're more long-standing in time. The symptoms must be evidenced for at least 2 years. So the biggest difference is that 2-year span for a chronic mood disorder, as opposed to the symptoms being present for more days than not for 2 weeks for a bipolar disorder or for a major depressive disorder. One of the chronic mood disorders, cyclothymic disorder. The other chronic mood disorder, or the other typical chronic mood disorder that we commonly see is dysthymic disorder. Cyclothymic disorder. This includes frequent periods of depressed mood and hypomania. Hypomania being similar to bipolar disorder, the hypomania side or the mania side. We'll typically see feelings of inadequacy with the person, inflated self-esteem. Typically the person will be very withdrawn from their friends, from their family members. They'll typically find difficulty concentrating, paying attention to things at school, typically paying attention to their work at their employment. One of the things that we find with cyclothymic disorder is that they may experience periods of feeling very normal. The dysthymic disorder, these are typically people who are very chronically depressed over a 2-year period. Again, the symptoms are present more days than not for at least 2 years. Just general feelings of sadness, again, for more days than not for at least 2 years. General loss of pleasure in activities, a general loss of pleasure in hobbies. Change in sleeping patterns, either an increase or a decrease in sleeping. Change in eating, that can be either an increase or a decrease in eating. Significant change in energy. Typically we'll see a decrease in their energy level. Very pessimistic, especially about the future. They kind of see no hope for the future, no relief in sight. Inability to concentrate or extreme difficulty in concentrating. I wanted to spend just a little bit of time talking about some of the theories of depression. One of the theories of depression is the psychoanalytic theory. This originated with Sigmund Freud, goes back to kind of this idea of depression starts in childhood. Typically what we see, or commonly what we see, is people that are very dependent upon others. This is anger turned inward. People who are suffering from depression, if we apply the psychoanalytic theory, there's a lot of maintenance of self-esteem, but that maintenance to improve their self-esteem is very dependent on other people. So again, it's a lot of they're looking towards others to bring their self-esteem up, to increase their self-esteem. So there's an excessive dependency upon others for that maintenance of the self-esteem. The cognitive theory. These are thoughts, beliefs that can actually cause emotional states. So we look at those kind of factors that influence emotional states, actually the way people think about themselves, the way they think about how they go through their daily actions, the way they believe about their beliefs about their own actions, and how these can relate and cause their emotional states. One's own thinking can be biased towards kind of negative interpretations about themselves. So what a clinician will try to do is try to change the way they think about themselves, help them change the way they think about themselves, help them change those negative beliefs, and hopefully in turn change those emotional states and relieve that depression. The helplessness theory, this talks about a person's inability to act or control his or her life. It's acquired through kind of unpleasant experiences that he or she has tried to unsuccessfully control. This kind of brings about this whole sense of helplessness, feelings of depression. So it's this inability to act that's acquired through unpleasant experiences. Lack of control brings about feelings of depression. So it's this whole lack of control that somebody feels about their whole life brings about these feelings of depression. The biological theories, there is support for genetics in depression. There's actually a support for both for genetics in both depression and bipolar disorder. Along with the biological theory, neurotransmitters plays a heavy role in depression and bipolar disorder. For example, neurotransmitters are those little things in between the axons in the brain that shoots off chemicals that helps the axons communicate with one another. And what psychiatry is all about is when a psychiatrist delivers medication, it helps compensate for some of the lack of those neurotransmitters. So, for example, if somebody is suffering from a lack of norepinephrine, which is a specific neurotransmitter directed towards, for example, depression, what a psychiatrist will do is try to increase the level of norepinephrine and increase or decrease those symptoms of depression. The decrease in a person's norepinephrine neurotransmitter kind of acts as or mimics the symptoms of depression. So increasing norepinephrine will relieve depressive symptoms. Serotonin is another neurotransmitter in the brain. A decrease in serotonin is similar to depression. Psychiatrists will try to increase the serotonin level and decrease the symptoms of depression. Some things about suicide. Some factors associated with suicide that I think we should keep in mind. Gender. Males will tend to take their lives 4 times more often than females, although females will attempt suicide more often. So the actual act of committing suicide, I don't want to say the success of committing the actual killing themselves, but the success rate is actually 4 times more likely with males than it is with females, but the attempts are higher with females. Age is another factor with suicide. Adolescents and older adults are more at risk of suicide than those in their 20s or 30s and their 40s. Mental illness is a factor with suicide. People who are depressed are more prone to suicide than those who are not depressed. Typically, people who are depressed are kind of going to feel overwhelmed. They feel helpless about their life events, that the future appears hopeless. One of the things that we look for is if somebody starts to describe feelings of hopelessness, it's kind of a red flag, especially for factors in suicide. However, everyone that is depressed is not going to attempt suicide. If we go back to those symptoms of major depression, we have to keep that in mind. Substance abuse. Alcohol is often implicated in suicide. A lot of times what happens is that people who are suffering from major depression, for example, will often try to self-medicate through substance abuse. Lack of social support is a factor associated with suicide. For example, research has shown that not having a spouse is a risk factor for males. Family suicide. A family member or a significant other person who has taken his or her life by suicide is often a factor that we'll look at. So if there's a history in the family of people who have successfully committed suicide, that's often a red flag. It's a factor that we have to take into consideration. Some warning signs of suicide. If the person is threatening to hurt or kill themselves, we have to take that as a serious warning sign. If they have access to guns, if they have access to knives, if they have access to either illegal substances, or they have access to prescription drugs, any kind of access to something that would assist them in taking their lives is a warning sign. Talking or writing about death, dying, or suicide. Suicide could be a warning sign. Again, as I mentioned before, feelings of hopelessness. Feeling worthless, a lack of purpose. Acting recklessly or engaging in risking activities, things that they may not have engaged in the past. Feeling trapped, kind of this feeling of having no way out. Increase in alcohol or drug abuse. Again, an increase that you may have not seen in the past with the person. Withdrawing from family, friends, or society, just a decrease in social interactions. Demonstrating rage, anger, or seeking revenge can be a warning sign of suicide. Appearing agitated or having a dramatic change in mood. Again, significant changes in any of these can be a warning sign of suicide. Some general characteristics of suicide. A higher level of planning indicates a more serious risk. However, an absence of a plan does not ensure the person's safety. Anytime any of those warning signs appears, that has to be taken seriously. So all thoughts, all of those warning signs, if the person starts to address any of that, it has to be taken seriously. A significant percentage of individuals who are not diagnosed with a depressive diagnosis will attempt suicide. So individuals who, just because they're not diagnosed with a depressive diagnosis, doesn't mean that they're going to attempt or not attempt suicide. There's a lot of individuals who, just because they're not diagnosed with a depressive diagnosis or a major depressive diagnosis, doesn't mean that they're not going to attempt suicide. So we have to even look for those warning signs, absent that diagnosis of depression. That brings us to the end of the webinar. This was brought to you by Health Directions. If you want to learn more about Health Directions, you want more information, you can schedule an appointment by calling 1-800-288-5912, or you can email Health Directions at healthdirections@ncbhs.org. If you have any questions about today's webinar, you can email us at communications@ncbhs.org. If you're interested in attending more webinars, You can go to Health Directions online at www.healthdirectionsonline.org. Health Directions offers both in-person and online counseling and therapy. Thank you for joining me today.